Welcome to AETCM, the Emergency Medicine channel. In this video, we are going to discuss about the first aid or primary management to be done for a victim who has underwent a snake bite in an out hospital setup. So snake bite, as we know, is one of the neglected tropical events that can result in enormous suffering and disability. So timely intervention can result in better outcomes of the patient. So let's do it right. So as per the acronym, right, the first step to do is reassurance. We need to reassure the victim. So obviously the victim will be in a panic state, which will result in increased heart rate and a rapid spread of venom. So we need to calm the patient down. Not all the snakes are venomous, and the bite will not be from a venomous snake. It can be a non-venomous snake bite as well. Or else, even if it is a venomous snake bite, it can be a dry bite as well. So first we need to calm the patient down, and next step is to immobilize. So for immobilization, very commonly the affected site will be the lower limbs. It can be upper limbs as well, but very commonly the site is lower limb. So we need to make sure that the affected site is still. We should not entertain the patient to walk, or we have to make sure that the patient is not involved in any kind of exertion which involves the affected site. So, and then we can use a splint or bandage to immobilize the area, just like how we do for a fracture. And if in an out hospital setup, if these things are not available, if a splint or bandage is not available to immobilize the site, you can use alternative things such as a scale or a cardboard, and we can just place it below the affected site, and you can use a sterile cloth and start draping it just above the fang mark. So even if you're using a bandage or a sterile cloth, you should not be covering it over the fang marks. You have to place it just above the fang marks, 1 to 2 centimeters above the fang mark. You have to start wrapping up to the previous joint. You have to wrap and make sure that the limb is not mobile at all. And while wrapping, we need to make sure that there is a space for at least for the insertion of one finger, so it ensures that the wrap or the bandage is not too tight. That if it is too tight, it can result in further complications. So after wrapping the bandage, we have to insert a finger and see whether it is going inside smoothly, or else we need to remove and wrap it again, so that it ensure that the bandage wrapping is not too tight. And next, GHT, it stands for get to the hospital and tell the doctor whatever that has happened after the snake bite. So we need to explain the signs and symptoms. So before getting to the hospital, you have to make sure, or you have to be aware of the hospitals in your locality where there is availability of anti-snake venom. Not all the healthcare facilities, not all the primary healthcare facilities will be having this availability of anti-snake venom. So before taking the patient, so that you can save the time, you have to be making sure that there is an availability of anti-snake venom in that facility. So these are all the things that you have to do. So I'll revise it again. So we have to do it right. R stands for reassurance or reassurement of the victim. I stands for immobilization of the affected site, and GHT stands for get to the hospital and tell the doctor what all has happened after the snake bite. Thank you for watching.